So for this video, I'll show you, like, say if the ET tube was kinked, or even the circuit, or the patient was coughing or had secretions. Just notice what the peak pressure is there, 21. So what I will do, I'm going to lay this down for a second. I'm just going to pretend like the patient is coughing. See that? See how the pressure is going up, up, up? The alarm that's coming up now is high airway pressure. Obviously the rate is gone up too, because again they think that the vent is making. So for this one here, again, silence the alarm, because once the alarm is gone, then it takes half the stress out of it. So again, for this one, I would see, is my ET tube clamped somewhere? It might be kinked off. Does the patient need to be suctioned? I'd go down and suction. Again, for suctioning, I'd hit this 100% O2 boost. Gives you 100% for 2 minutes, and it also gives you that alarm silence for 2 minutes. Because I'm telling you, half the battle is dealing with that alarm. So if you can stop the alarm, you'll be able to think way, way better. So again, that was it for that. I'm trying to think of other stuff. But I think that's two of the main alarms you're going to see, is like a patient disconnect, or if they're coughing. Again, sometimes this alarm might go off, like say if the patient's coughing, coughing, coughing. Again, that's coming up. 2 minutes is on, so you won't get that alarm. And they just resolve themselves. Like, there's not really, like, you don't have to rush in. If the alarm is constantly going, then you'll obviously have to go in and see what's going on. But yeah, I think that's pretty much all I will say for them. So I'm hoping this is not too confusing, and I'm sorry if you're getting sick from my videos and my shaking and moving around. Anyways, I hope that these help. If anybody got any questions, by all means come and ask. But yeah, that's the main thing. Just remember, everything is touchscreen, and everything here is what's set. So again, if you want to turn up oxygen, you can. If you want, well, obviously the peak, the rate, and the tidal volume, we would get a doctor's orders. Anything on this side is what the patient is doing, physically doing. And on this side is like how you set your parameters. So you don't really need to, like, we set the mode, we set the alarm limits as they should be appropriate, and all the other stuff just disregard. There is a disconnect suction button. You can also use that as well. I just find the O2 one just easier, press and hold. But you can, it says preparation, pre and post oxygenation concentration, and then you just 100%, you could change this if you wanted, like the up and down. But majority of the times we do 100%, and you just hit accept. And it will go, it'll say disconnect patient within 2 minutes to start suctioning procedure. So we don't actually physically disconnect them, because I think they're talking about the olden days when we didn't have the inline suction and you had to go down with just a catheter. We're not going back to them days, because we want to keep that closed circuit, especially with these COVID patients. And that's it. Like, it will go through this 2 minutes, then it will do the whole patient disconnect, and then the post. But again, I just likes the 100% O2 boost, so I'm just going to get out of that. So I mean, do whatever you're comfortable with, but again, that's an option there. But that's way more simple. That's just quick and easy. Press hold for 3 seconds, and then you got it all good. Yes, so that's about it, I think, for this circuit. And again, I'll do the standby. So if put it in standby, you touch that, stop ventilation, press and hold for 3 seconds, and it's in standby. And again, for the off, this is on the side of the vent. So that's the front of the vent, the side of the vent. Open it up. And again, it's down here. So you pull it down and push it across. And when you hear that cheep, 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 that means it's off. All right, so that's the Servou U in a nutshell. Again, hope this helps.